So when people are looking for life partners, they tend to have so many qualities that they're looking for, which is okay because love is a beautiful thing. It's very nice to look at. It's a good feeling. But the question is, are you asking the right questions to your partner? I do not mean their favorite color, their favorite food, their dream travel destination. No, I don't mean hobbies. I mean things like, do you know your partner's HIV status? Do you know their genotype? Do you know their medical history? And the purpose of this video is not to make people little detectives. Now you're going to go and get a blood sample of your partner, go out and do this test without their knowledge. No, the purpose for this video is to give you the right information, prepare you for the future, and you making the right decision for your happily ever after. By the way, my name is Samantha Tabiramo. I am a nurse. So like the video and share it. You never know whom you're helping out there. So what are the tests and the questions that you should be asking? What is your genotype? What I mean by genotype, this is the genetic makeup of an individual with regard to the hemoglobin genes. So you have to ask your partner, what is their genotype? Is it AA? Is it AS? Is it SS? Is it SC? OSC. And of course, when you're speaking about the genotype, you do not forget to talk about the sickle cell disease. Now, what is sickle cell disease? Sickle cell is an inherited blood disorder that affects the hemoglobin, the protein that carries oxygen throughout the body, normally affecting the red blood cells. So I have been born, raised, studied in Kampala, and I'm going to be honest with you, I have never seen Kampala where they're like, oh my God, this is a hotspot for sickle cell. Not to me, I haven't had it. But the hotspots that people talk about, for example, I have heard people say that the East has a lot of sickle cell, or maybe this place has a lot of sickle cell. In Kampala, when I was doing my clinicals, when I was still in school, Mulago has a full ward that is for people with sickle cell. So if you go to Mulago, there is a ward. I think it was up. I don't know if it's still up because of the renovations. I don't know if it was put somewhere else. But when I was there, you had to move up. It's like the kids area there. It's opposite family planning. Yes. I don't know if it's still there, but after family planning, you just continue a little bit up. That is where the sickle cell ward is in Molago. But when I went for my internship in the north, by now everyone knows that I did my internship in Lera. You people, I have never seen a lot of sickle cell in one place. Like there were so many patients that had sickle cell in one place. And I was like, oh, I used to tell people, I have never seen people suffering from sickle cell disease, a lot of them in one place like I've done in the north. They used to come in with a lot of pain. The diagnoses were always the same: pain, malaria, anemia. Pain, malaria, everyone used to have that. So we used to treat mainly children. I haven't seen, maybe there was one who was a 20-year-old. I think that is the oldest that I have seen when I was doing my internship. But most of them were young, and they were being cared for by their parents. And I want to say this, that up to now, I think for me the problem is knowledge gap. So for me, I feel like sensitization, health education is still a problem. People do not even know what the things are. When you're looking at the television, they're always telling people about malaria, sleep under mosquito net, cut long grass, remove stagnant water, this and that and that and that. But you've never seen an ad that runs year in, year out that is talking about sickle cell. It's not there. So again, the problem is knowledge gap. These kids are normally taken care of by their mothers. Fathers are always saying that these diseases are not in their family. So women, but practically women, when a person says, okay, I'm interested in you, we need to move further, this and this, please screen yourself. Screen yourself for sickle cell disease, because if you start having children that have sickle cell disease, most likely the man is going to tell you that for them they do not have sickle cell in their family. So it is you who is going to be looking after this child. You're not going to be in the hospital all the time, because they are normally in pain all the time. So women, please screen yourself for sickle cell disease. So if you have a child that has sickle cell disease, they will normally start showing signs in the first year of their life. That is 5 to 6 months. And you will normally see that the child, they have swelling of their feet and their hands. There will be episodes of pain. They will have painful erections. That is what we normally call priapism. And they will have tiredness all the time. You'll always be going to the hospital for anemia. There'll always be jaundice, that is the yellowish color of the skin. There will be frequent or recurrent infections of these children. So when you're treating sickle cell, it is normally avoiding or preventing episodes of pain, treating symptoms, and preventing complications. Most likely, you're going to be managing the pain, you're going to be treating the infection, and you're going to be preventing complications. That is what we do. The drug that is normally prescribed is hydroxyurea for these sicklers, and this one reduces the frequency of the pain crises. And then definitely there is blood transfusion and pain relieving medications. That is normally what we use in the treatment of sickle cell. I'll make a full detailed video about sickle cell anemia one day. But right now, let me just show you how sickle cell happens with these genes or the genotypes. I'm just going to show you how sickle cell happens with the different genotypes. So here we have mentioned how A, this one is very normal. And then we have AS, these ones are carriers. And then we have SS, these are the sicklers. So with the AA, this is very, very normal. These ones can get married to each other and their children will have no issues at all. However, the AS and the SS, we have to find out. So if you have AA, if one partner is AA who is normal and the other partner is a carrier, this one here, you're going to have, there'll be a cross match, which is AA. You're going to have a normal person. Then you have S, which is A and S. This is a carrier. Then you have A. This one is a normal person. And then we have A and S. This one is a carrier. So the one partner who has normal genotypes and one who is a carrier, these ones can absolutely get married to each other. But there is no guarantee that all the kids you're going to have are going to be AA or they're going to be AS. No, this can fall on any child. But however, if you have, if these two get married to each other, it is okay. Our next cross match is a person with a normal genotype, that is AA, and a person who is a sickler. These ones, when you do your cross, you get AS. This is a carrier. When you make another cross, it's going to be AS. This is also a carrier. When you make another cross, it's going to be AS. This is also a carrier. When you make another cross, this is going to be AS. So these ones too can get married to each other because as you can see, all these ones are carriers. So these, a normal person and a sickler, these can also get married to each other. At least it's better to have this than having this. So this, a normal person and a sickler, you can also get married to each other. However, if we get a carrier and another carrier, so the first is you're going to get a normal child who has nothing like a sickle cell trait, which is also okay. Then the second one, you're going to get a carrier. Third one, you're going to get a carrier. Fourth one, you're going to get a sickler. So this, we don't advise them to get married. So a carrier and a carrier don't get married to each other because we want to avoid this. So if you get married to each other, you are going to get a what? A sickler. And there is a 25% that you're going to get a what? A sickler. And I've already said that there is no guarantee that you're going to that this is how it's going to happen. That you're going to have a normal child, then you have a carrier and another carrier. No. It may happen that all the kids you have are going to be sicklers. It may happen that all the kids you have are going to be carriers. It might also, there's also a 25% chance that the kids you may have might be normal, but there is no guarantee. So in order to prevent the SS, it is better for these carriers not to get married to each other. So we go to the next one. We have a carrier and a sickler. So we have this. You have your first one, you have a carrier first. Second one, you're going to have a carrier. Third one, you're going to have a sickler. Fourth chance, you're going to have another sickler. So here also, I would advise a carrier and a sickler not to marry. Same reason, to avoid this. Immediately you see this is very, very dangerous. You do not want to bring these children into this world that are going to have, who are going to be sicklers, and are going to have the sickle cell trait. So what we do, we always advise sicklers, and carriers not to marry to prevent this. I've already told you, same explanation. There is no guarantee that all the kids you're going to have are going to be carriers, all the kids you're going to have. So in order to avoid this, just don't get married to each other. A carrier and a sickler don't get married to each other. Now, the last crossing, genotype crossing, we have a sickler and another sickler. Now, this one, before I even cross, you just see what is happening here. We are getting sicklers from the very beginning to the end. This is not good. So a sickler and a sickler do not even look at each other. You're not supposed to get married. Do not get married to each other. Look for a person with AA if you're a sickler. Do not get married to each other. These two don't get married to each other. So this is what these are some of the possibilities that can happen if a normal person and a sickler, then a carrier and a sickler. So this is what can happen. Try to avoid, at least if you are a sickler, get a person who is normal. If you are a carrier, try getting someone who is normal. Do not get married to another sickler, another carrier. It is not good for you. In conclusion, make sure that both of you have screened yourself for sickle cell disease. So do both of you know each other's HIV status? So HIV, or the human immunodeficiency virus, is a virus that affects the immune system of your body, making it harder for you to fight infections or diseases. So it is very, very crucial for both of you as partners to know each other's HIV status so that you can prevent transmission. And if you have HIV, you can treat this early so that it cannot progress into AIDS. I worked briefly at LIDC, and it is a section for people who have been infected with HIV, and they would come, we would do counseling, we would do health education, we would do refilling of the drugs, we would treat any other medical condition that they have come with, and most importantly, we would check their viral load. If a person takes their medication the way that they're supposed to take it properly, without missing, without having this excuse of, oh my God, this and that, just having discipline of taking your drugs the way that you're supposed to take them, this virus cannot be detected after some time. So some patients would come and we check the viral load, and the virus will not be detected. It will not be detected in the bloodstream. So at this point, you cannot transfer it to another person, which is a good thing. And that is where it is very, very important for both of you to know each other's HIV status so that you can protect each other. And if your partner is not willing to share this information, second guess this relationship. It's not going anywhere. If you cannot trust me enough to tell me that, hey, let us go for an HIV test and we both share each other's HIV statuses, second guess that relationship. What is your blood group and rhesus factor? So what I mean by blood group, it refers to the ABO type. Are you A? Are you B? Are you AB? Are you O? Then the rhesus factor refers to the presence or the absence of the rhesus protein on the red blood cells. So if you go to the hospital and you're checking your blood group, or you want to find out your blood group, they normally do the rhesus factor too. And they normally give you results where there is maybe an A and there is a negative up, or a B and there is a positive up. So the blood group is the AB, ABO, and then the rhesus factor is the presence or the absence of the rhesus protein in the red blood cell. So you will have that negative or you have a positive. This is very, very important because it saves people from the rhesus isoimmunization and blood group incompatibility. Now, rhesus incompatibility happens when a woman is a rhesus negative and her partner is a rhesus positive. And this one brings normally complications in pregnancy, such as hemolytic disease of the newborn, where the mother's immune system attacks the baby's red blood cells, looking at the baby as a foreign body. Let me explain this very, very well. So when you are a rhesus negative and your partner is a rhesus positive, the body usually recognizes the positive antigen as a foreign body or object. And normally the body's immune system is going to fight it. So during the first pregnancy, when both of you have conceived your child, it's going to be okay. You're going to carry your baby to term, you're going to give birth to it. Now, during childbirth, if there is any bleeding and this blood enters into the woman's system, the body is going to create a memory around this positive antigen and it's going to wait. So when the woman becomes pregnant again, the body is going to say, wait, 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 wait. We know this. This is not ours. And when the body does that, it is going, remember, it kept a memory of the positive antigen. So guess what? Your body's immune system is going to start fighting against your child. So your body is going to attack your child. And that's why you're going to hear cases of recurrent miscarriages. You'll be there, you're saying, but I had my first child. What is causing the death of my second, my third, my fourth? It's because your body is fighting against that child. The body is looking at that child as a foreign body. So every time you conceive, the body is like, no, this is not ours. This is not ours. So the most important thing is before you even start dating someone, people normally say first date. But I feel like after the first date, when you look at this person, you feel like something may happen. I think maybe the third date or the fourth date, you should be talking about these things. You don't need to drag someone like, hey, let us go learn about our blood groups, our HIV status, our genotypes. No, just talk about these things. The further you go, you're like, we talked about this. Like, create a foundation of trust from the very beginning. You talk about these things, and when the time comes, maybe you're ready to take it to the next step. You have already done this test. You know where each of you stands. And if things are not the way that you have envisioned them, it's also okay to walk away than start having situations in your marriages that you're like, but what is happening? So it is okay to walk away. So in addition to the blood group and the rhesus factor, you can also do a complete blood count, that is a CBC. This is a blood test that normally measures the different components of blood. For example, the red blood cells, the white blood cells, the hemoglobin, platelets, and more. And it also identifies some medical conditions like anemia, infections, and blood disorders. The CBC is a basic test. Yes, we do it for everyone, mainly who comes to the hospital complaining of maybe infection, maybe anyone who is anemic, to find out like what is their HB before transfusing. But it is a basic test and it is normally done to ensure that the person is in good health to support their partner. So I would encourage you, yes, you've gone for your blood tests and maybe you're doing a blood group or maybe you're doing a rhesus factor, just check in. So maybe, can I just have also my complete blood count or my CBC done, to just look at these simple things. Our next point is the medical history. Medical history, I'm talking about chronic conditions like hypertension, diabetes, heart diseases. These diseases can affect marriage and also childbearing. For example, diabetes can lead to high blood sugar levels, which can affect the baby's development. And then we have hypertension, which can increase the risk of preeclampsia, which can be life-threatening to both the mother and the baby. Some medical conditions can be genetic, some are not. But you have to know the medical conditions that are in your partner's families. This is the information that both of you should have so that you can support each other moving forward. You have to talk about the sexually transmitted diseases. Screening for STDs is very, very crucial. STDs like hepatitis B, syphilis, chlamydia, gonorrhea, and others is very, very important. And some of these infections are asymptomatic, meaning that a person can be having an STD and they may not even know that they have it. So if you've had these STDs in the past and you have not treated them properly, there are high chances that they are going to affect your fertility. So you will have issues with your fertility, and then there is going to be problems with your pregnancy outcomes. For example, hepatitis B can be transferred to the baby if not treated. And then your general health. People, there is no partner that is going to be happy with another who is always just treating STDs. So if you feel like you have them, please go to the hospital, have yourself treated, and make sure that you inform your partner and are also treated. If you're being sexually active together, make sure that both of you go to the hospital and both of you are checked. Another thing is treatment options for most STDs is very, very available. And also some like hepatitis B have vaccines to prevent further infection. In addition to the sexually transmitted diseases, you as a couple, you can do also a urinalysis. This is a simple test that examines the urine for any signs of kidney disease, diabetes, urinary tract infections, or UTIs, and any other metabolic conditions. So it can detect high blood sugar levels, that is a sign of diabetes. Then if there are any proteins, that is a kidney disease. And if there are white blood cells, that is a sign of an infection. So early detection of these conditions is very, very important to treat them early and prevent further health issues. Fertility is another question you should be asking your partner. Before marriage, it is important for both of you to discuss fertility issues in your families and between the two of you. Both of you should be comfortable enough to go for reproductive health tests. What I mean by reproductive health tests is, for example, men can go for the sperm analysis to check their sperm count and quality. And then hormonal tests. With hormonal tests, I'm talking about all tests: the follicle stimulating hormone, the estrogen, the progesterone, the testosterone. Like this one has to be for both of you, the boyfriend and the girlfriend. Both of you have to go and make sure that your hormones are balanced out. And then of course the women, you also have to go for the test of ovulation. And another thing is the pelvic ultrasound to assess the internal reproductive organs of the female. This one goes out to men especially because they're the ones who are always saying for them they don't have fertility issues. Sometimes you're actually shooting blanks. Like you're playing the match, but you're shooting nothing. It's blanks. So with all the technology that we have right now, I feel like both of you should go for the reproductive health tests, find out who has the problem, have it treated, and so that you can move forward in your relationship. So the last test that I think you should consider is mental health screening. So screening for conditions like schizophrenia, mania, depression, anxiety, bipolar, and others can help couples address potential challenges early. First of all, there were over 8 billion people in the world, but you chose to be with that person. One thing that I would tell someone is, if you know this, they have not like hidden it away from you, and you've accepted this, you have to be positive. You have to be supportive. You have to be positive. You have to know how to handle your partner. Everyone has an issue. But if you know that your partner is a mental patient, is a diagnosed mental patient, is on medication, make sure that you are supportive. You have to be understanding, you have to be patient. Because if anything goes wrong, guess what? If you're around, you're the one who is going to receive whatever they're going to give you. So you decided to be with this person, make sure that they're taking their medicine. If they need company to go to the hospital, you have to be there for them. If they're having any breakdown, make sure that you are there for your partner. Because these are the situations that are going to help you understand your partner. They're going to create that, build that relationship you have. You're going to be supportive and all that. But if you cannot handle this, people, it is okay to walk away from the relationship before it mounts into more serious things. It is okay to walk away if you cannot handle some things. Mental health issues are serious, they are real. And it's unfortunate that in Africa we are not so open. Okay, it's there, but it's not like we don't talk about it like the way the European countries do. It is not something that we openly talk about, but it is there. Mental issues are there. And if you have a partner that is a mental patient, not even only those conditions I have spoken about, even alcohol. Alcohol is also a drug. In Butarica, there is a section for people who have abused alcohol, and they've abused, they call them creative drugs or something. I'm talking about marijuana, I'm talking about cocaine and all that. Also, those drugs can actually make people have mental issues. So it is not only about people who have been diagnosed with them, even people who abuse drugs can get mental issues. So if you know that your partner is abusing drugs, pethidine, know what you're going into. It is okay to step back, Or it is okay to say, let me try and help my partner out. There are people who are on these journeys of, I can change him. Good for you. Whatever you choose, it is all up to you. But if you've decided that you're going to go into this together and move forward together. So those are some of the tests that I think that you should not enter any relationship, you should not enter any marriage, you should not be engaged or even start any sexual intercourse without doing. You should start your relationship with trust, with transparency, and the right information. So that is all from me. Do not get emotional. Make the right informed decisions about your future. I wish you the best in all your respective marriages and relationships. See you in my next video and all the best.